All right. Joining us today is Dr. Adam Abodeely. He's got a lot of different career paths and been working with cannabis for a while now. I'm really excited to talk with you. And we're recording this on June 8th, 2022. So, a quick introduction, and then we'll dive into some content around the science and business of cannabis. So, you're the author of A Surgeon's Perspective on the Science and Truth of Cannabis. CEO and co-founder at Coral Cove, interesting wellness model in Jamaica, a resort there that you started working with. And then your background, why I think you bring so much credibility and importance to the industry is really from the medical field. And so you are the founder and CEO of, I might pronounce this wrong, but Adirondack Gastrointestinal and Colorectal Surgery, founder and CMO of Reserve MD. So I'm excited to talk with you on a lot of different angles, Adam, but thanks for taking the time today, coming on, sharing with our listeners, and excited to learn your experience from the cannabis industry, and I'm sure it's been an interesting path.
Yeah, thanks, Wayne. It sure has been an interesting path. I always tell people, told me 10, 15 years ago that I would not only be in the cannabis industry, but that I would, be involved in this cannabis venture here in Jamaica. And I mean, I would have told you were crazy, but here we are. So
interesting. Yeah, where the industry can take you as things unfold. We'll dive more into the second half around the business. I'm interested in the different, models and what you're currently working on. But I think just to set the timeline for listeners, you're originally based in New York, and then, the legal program there came online 2014, and maybe set up what happened before 2014. You were getting probably patients coming in talking about cannabis. And at some point you're like, I got to look into this, which then led to a lot more investment into the area.
Yeah, absolutely. I think everybody involved in the cannabis industry has an interesting story to tell in this day and age. But and I think that I've got a relatively interesting perspective as well, because I've been in practice now in private practice for 12 years, and I specialize in surgical oncology and gastrointestinal conditions, which include such things as inflammatory bowel disease. And for those of your listeners, most of your listeners are probably well aware of the fact that these are some of the most common indications for cannabis use medicinally. And so prior to 2014, I'm in northern New York, in Lake Placid, New York, which happened to have a relatively robust culture of cannabis consumers, and even prior to its legalization. And so early on, I was getting sent from our medical oncologist patients who were to convince them that they should stop consuming cannabis because they have cancer, and because they're going to be going through chemotherapy. So I was initially brought in to tell them to stop consuming cannabis. And so in order for me to do that, I had to educate myself. And I said, oh, this will be a piece of cake. And I start looking through the literature, and I start realizing that, boy, I've got a lot more reasons I should tell them that maybe they should be considering, and maybe some of my other patients should be considering medical cannabis, than reasons why I should be recommending that they don't use cannabis. Now, of course, there's particular considerations during chemotherapy and things of such that we have to be mindful of. But I found mostly positive aspects of utilizing cannabis for a lot of these conditions. And just prior to 2014, when New York became legal, many of my patients who I'd spent the previous years kind of counseling them and educating them about the use of medical cannabis after I educated myself, a lot of patients started asking me, well, once it becomes medical, are you going to start certifying patients in New York? And I said, well, listen, I'm a surgeon. That's what I do. That's not what medical cannabis is not what I do. But they, and when it became legal, I tried to get buy-in from a lot of the surrounding doctors, and nobody wanted to do it. Of course, they had a preconceived notion that it was voodoo. They were concerned about their perception and how they'd be perceived amongst their peers and amongst their other patients. And they, and another important point I think of this is that some of the ones who were somewhat interested said, I'm employed. They were told they couldn't do it because they were hospital employees who received federal funding. And since cannabis is federally legal, they were not allowed to even discuss it with their patients. So I felt that it was in, the best interest to serve my patient population to be able to at least certify them and give them access to this, this wonderful, plant that has medicinal and therapeutic properties. And it really is just really escalated from there. We've opened up our practice to treating, patients with a variety of conditions, and we have we've seen thousands of medical cannabis patients, in our practice, and I've trained other providers to assist in that volume as well, of course.
Yeah, and I think I'm always interested too on how that's evolved. Maybe going past when the tipping point might have happened as far as acceptance goes. But we'll save some of that up for the business conversation. I wanted to get into kind of focusing on the science side, and I've watched some of your talks and some of your content, and I've found some really interesting points that intrigued me. I don't think we've covered on the podcast before, and one of them was around the placebo effect in cannabis. And so we've talked about the placebo effect before. Most people are kind of familiar with that general summary of what it is. And you brought up a point, I think, about cannabis potentially working maybe in a physiological way, but maybe having some kind of impact on the placebo effect. So the first thing I wanted to ask, has there been any discovery or findings of the mechanism of the placebo effect? Like how that does work in the body, or is that just completely unknown? We just see it in the data and the numbers, and we're not sure why it's working.
Yeah, we do have some science on that. It's not fully understood about the placebo effect, and I apologize right now, I can't quote all the science on it, but absolutely, the placebo effect is real. The placebo effect is not. You have to ask yourself, well, why, if we perceive something to have a potential positive effect, does it actually end up having a positive effect, even though it's not a direct result of that input and that variable? And and we do have a mechanism of understanding of how that actually happens, and the pathways by which it happens also happen to interact with the endocannabinoid system in a positive feedback fashion. So anything that feeds this placebo effect can also be fed by enhancing the function of the endocannabinoid system.
And is there through the endocannabinoid system, the placebo effect is, it's kind of like it's like belief, like mind over matter, that old saying. Is there a connection there of how the belief of something being positive does that mechanism in the body, or how cannabis is affecting that mechanism and result?
Yeah, and I think a lot of that has to do with the level of our stress hormones, which are floating around our body continuously, and we know that when stress is a bad thing, right? And I see this in patients, and I'll tell you, of course, this is purely anecdotal, but when patients come into me who have with a new diagnosis, when I have to inform them of a new diagnosis of cancer, okay, there's lots of different emotions and reactions which go into that diagnosis, being told, informed of that diagnosis. And when, and it's always interesting to me to see how people vary in the end when they take a positive approach to their diagnosis and as opposed to a negative approach. And, if you speak with oncologists, they'll tell you the same thing over and over again. It's things that we might not be able, to explain. And the question is, why is that? Well, I think a lot of it has to do with, our natural immune system, which again, we know what has a tremendous influence on our immune system is our endocannabinoid system. And, so by keeping a health, everybody thinks of our immune system as our ability to just fight infection, when our immune system actually plays an extremely important role in our ability to detect and destroy cancer cells in our body. So, and so anything that's going to potentially, inhibit our immune system or increase our level of stress hormones can potentially lead to a negative outcome. And therein lies the potential influence of the endocannabinoid system and how it can not affect our immune system, but also how, we perceive our external stressors in our environment and the downstream and cascade effects of what could happen from that input.
Yeah. Yeah, it's such a tricky area. We did a podcast a little while ago. I don't remember the guest, but they were talking about pain and cannabis maybe having an effect on the actual pathways, but then also your perception of the pain. And it's a very interesting area. Like I've heard, stress is the number one killer. But what exact, we can look at stress hormones, maybe some certain after the fact metrics, but no maybe leading indicators to measure stress as a factor, and just cannabis potentially lowering that stress then allows the rest of your body to work. And so is that placebo? Is that physiological? It's such a hard thing to nail down, especially in Western medicine that does a black and white molecule that is on and off, or something very simple. Talk about placebo. Right. I mean, doctors have to hate that category, I would imagine.
Oh, yeah, absolutely. Absolutely. No, you're absolutely right. It's a very tricky situation, but the placebo effect is real, and and what drives that, I think, is something we definitely don't fully understand. But the endocannabinoid system has been it's been indicated that it definitely influences this behavior as well. And then we can certainly talk about it's challenging with cannabis to have a placebo effect, particularly when you're using THC, because most people can experience the intoxicating effects of it, and et cetera, et cetera. But the endocannabinoid system, I have no doubt, plays an influence in the placebo effect, and hence why cannabis might also play a role in that as well.
Yeah, feeling of well-being when your endocannabinoid system is in balance or homeostasis. It's when you sleep well, eat well, and exercise, you have that feeling of contentness. And if cannabis can bring that, it just kind of helps balance everything else out. So it's interesting as well.
And I would take that one step further in saying that anything that can enhance enjoyment in your life, and give you happiness, whether it improve the experience you receive when you're listening to music, or when you're performing art, or whether you're with your significant other or your spouse, anything that can enhance joy in your life has a positive effect on stress, which hence has a positive effect on your overall wellness.
With I mentioned pain earlier, and something else I saw you talk about was the different types of pain and inflammation. Could you describe those different types to listeners? And I want to talk about how cannabis might help with those different types of pain, but maybe define those first, and then we'll go from there.
Sure. So the different there's lots of different types of pain. For example, one type of pain is inflammatory pain. Right? Somebody has an infection, and we all know that if we get a cut on our hand, it might hurt, and then the pain might go away, but after time, all of a sudden it becomes red and swollen and hurts, and that causes some discomfort. And you say, well, why was that causing discomfort? Well, that's some inflammatory pain. There's certain chemical molecules that are released during infection, which will trigger our nerve fibers, and we perceive it as pain. And then of course we have mechanical types of pain as well. This is our common trauma. We hit our hand with a hammer, we fall off our bike. These types of things will cause direct trauma to these pain. And then of course we have neuropathic pain. Neuropathic pain is when the nerve endings become either destroyed or damaged in a way that our body they basically fire and falsely fire at an abnormal level, which then we perceive as increased pain.
And those three categories, and then I saw you talk about also chronic pain versus acute. Would the first two of those, like inflammation from a after an infection, or mechanical pain, be considered acute? And then the third one, neuropathic, be chronic? Is that a good way to break them up?
I think so for the most part, although with inflammatory pain can be chronic as well, particularly in patients with autoimmune conditions, or, our patients with Crohn's disease and ulcerative colitis. These patients experience pain, which of their GI system, which has a completely, different, I guess, or a lot of ways, very different mechanism, but nonetheless, that's a form of chronic pain as a result of chronic inflammation.
And I think I heard you say that most of the studies or focus around cannabis have almost all been on chronic pain and not much looking at acute pain.
That is true, and we most of our evidence that we have, at least a positive proof that cannabis is an effective treatment for pain, is surrounding chronic pain and not acute pain.
Mm-hmm.
Now, having said that, being the known cannabis physician in the area, as well as being a surgeon, I've had several patients who have refused narcotic a prescription, which is standard to give to all my post-operative patients who refuse it. And I say, well, what are you going to use? And they say, I'm going to use cannabis. And I say, are you sure? Have you done this before? They say, yes, I've done this before and this works for me. And so, there is a role for cannabis in acute pain syndromes, but we don't really know exactly what that role is yet. However, there was this was even brought up with amongst my surgical associations, saying that this is something, that we need to look at, not only because there's a potential role for it, but also because there are some potential considerations when it comes to patients who are undergoing general anesthesia and surgery and such, if they're cannabis consumers.
Yeah. Have you noticed any trends with your patients using it for acute pain, like you mentioned? Really high consumption levels, any trends or things you've noticed of why that the ones that it does work for? Anything interesting?
We're coming to this era where there's this big push to get people off of opioids, and several years ago, before chronic pain was one of the indications in New York, and it wasn't a few years later until anybody who was on opioids was considered a candidate for it. But so it's hard to say if it's a direct correlation between our push to get people off narcotics while at the same time offering them cannabis. But I will tell you, cannabis, we know the data tells us that. I haven't studied our own internal practice data to be able to give you some exact numbers, but our we've had a tremendous amount of success of weaning patients off opioids using cannabis, while at the same time their chronic pain management providers are working with them to de-escalate their opioid use. So it's certainly been a tremendous tool and a weapon against the opioid problem that we know exists in this country.
Yeah. Yeah, the acute pain is interesting. My feeling, just from people I've talked to or seen, is it seems to be more experienced, higher consumption users. Again, it's just purely anecdotal, but it almost feels like it's dealing more with the perception of their pain. Because one thing with cannabis, like if you took someone that didn't consume cannabis, they had broke their arm, and you're like, here, try this cannabis product. It doesn't make the pain go like alcohol or an opioid might. Like sometimes it can make you hyper focus on the pain and make the pain worse. So but that's almost a game in the mind that maybe the experienced user like has adapted and evolved to it and kind of knows how to use it or control it or something. And a new user just freaks out, feels worse. That's kind of strange how it works both ways.
You're absolutely right. You hit the nail on the head. And just as an example of that, those who have told me that, no, thank you very much. I'm okay. I don't need a prescription for narcotics. I'm just going to use cannabis after when I get home. These have been very experienced cannabis consumers.
Yeah.
So they've figured it out. And, that's part of cannabis, medicine. It's part of cannabis as wellness. It's part of cannabis as a recreational component. It's such a personalized experience for people, then you throw in the component of experience, and once people gain more experience using it in any of those types of settings, it becomes a different experience for them as well over time.
Yeah, and you kind of change your dose or different product consumption methods. When you have someone maybe dealing with pain and looking at cannabis and they are newer, is there a certain, path or starting point you send them down? And I kind of want to talk about minor cannabinoids. And I'm curious if you use those in a specific way and around pain if there's an application there, or do you kind of start with like a simpler THC CBD ratio and then, kind of go from there? Kind of what's that process?
Yeah, well, unfortunately, or, in New York State, we are really limited from a medical standpoint of what we can recommend, and not only what we can recommend, but what they can actually access, when they go to the dispensaries. And in New York State, everything, our recommendations have to be solely around the THC and the CBD content, and ratios,
Okay.
as well, and then just the route of administration. So, our ability or our inability to, to really to recommend these other cannabinoids, at least from a medical perspective and from under the laws, rules, and regulations, so to speak, don't allow us to, particularly, certify patients for those types of things, or even, talk about that for that matter. But however, having said that, I've gotten some pretty savvy patients over the years who will come to me and say, hey, I know that CBC is great for inflammation. And I say, all right, yep. And I've seen those studies, and I can certainly support that those studies, show that preclinical data does suggest that. So, am I opposed to you trying to find a commercialized product that is high in CBC or, CBG or some of these other minor cannabinoids that people are starting to become more familiar with? I'm a full proponent of it. I tell them that, there's just a lot that we don't know. And I try to be very honest with them about, what we do know about regarding these minor cannabinoids.
Yeah. With those limitations in place, something else I've seen you talk about, is IBS or Crohn's disease. That's been really your focus, and around terpenes. So if you're not allowed to just, full spectrum products, I don't know if you're not allowed to really talk about terpenes, but I saw you talk about maybe some being potentially good if there's irritable bowel syndrome or something with the gut, and then some that could be really bad and you shouldn't consume. Are you allowed to cover terpenes in New York?
Well, it's interesting because the dispensaries have their own specific guidelines that they have to follow, and we actually receive their educational information, and they actually do educate their consumers about, different types of terpenes. However, they don't, they're not allowed to necessarily say that this product, because it has a higher level of, limonene or beta-myrcene, might be better for any particular condition. And in my realm, the biggest thing that I've noticed is that there's a lot of products right now out in the market that, are putting all sorts of terpene formulations and things like that. And the biggest thing that I've noticed, particularly in my patients with irritable bowel syndrome, is that when they take a lot of these medications that have been enhanced with multiple terpenes, they get quite a bit of GI distress, over it. And that is something that I've noticed, time and time again. And in fact, we've formulated some of our own CBD products with a variety of different terpene formulations. And, I've had, patients who are, been very willing to say, sure, I will try that, as an alternative to my treatment. And some of the feedback, particularly when we get these a little bit higher levels, and whether it's the ratio of the terpenes or whether it's the concentration we're using, which we've always tried to remain very close to the terpene concentration within the flower and plant itself. But yet when we add these in, a lot of times we've seen some GI distress. So that is just some of the feedback that I continue to provide with my patients, is that, try to stick to, a natural product. And, because we don't know quite enough yet about, how these terpenes are going to actually, affect us, then, you might just want to be mindful of that.
Yeah, really careful. And the dose or concentration, I think if you're not informed on the science and you approach terpenes like you might put in isolate in your product, the terpene percentage is so minor and much smaller compared to like a cannabinoid percentage and how much is in the flower. If you over increase that, terpenes can be pretty nasty when they're in high concentrations. If we've ever left like a plastic, eyedropper in a terpene bottle, like that thing will melt in there. So, and that's
Absolutely.
99%. I mean, it's super concentrated, but still, yeah, I think those going in the
Yep.
gut. Have you found then, or just from your, general recommendations, certain terpenes that you think might help or at least are neutral, and then ones that you've seen have more negative consequences around gut health?
Not particularly around gut health. I think that my experience with particularly with some of the athletes, and again, here we go. Is this a placebo effect or not? Is with the use of beta-myrcene, and particularly at higher concentrations of that, we've definitely had some reports of it being sedating. And that's consistent with how what we already know about beta-myrcene. And but other than that, I can't say that we've been able to find a direct correlation with a particular terpene to have a particular effect, other than the fact that we definitely know that particular concentrations people tend to react to more positively. Now, can we say why that is? We're not quite there.
Yeah, yeah, yeah. And everyone's, especially if you have a gut issue, I guess everyone's so variable and different, each person's scenario. I mean, there's tons of different cases of why someone might have a gut issue or disease or something going on. So it's probably gonna be hard to say across the board, these help, these don't help. Yeah.
And edible, people who have GI conditions, when you introduce an edible, if they have, you're just throwing another, variable into the situation here, where maybe their GI tract's not going to tolerate that. And so as much as I love the idea of delivering cannabinoids directly to the GI tract, and almost what we would think as a topical fashion.
Right.
Most of my GI patients, I really steer them more towards an inhalational form to start, because if they have a bad reaction to it, there's so much variability with GI conditions when it comes to absorption. When it comes to how they metabolize things. And then of course, we already know that the oral administration has, creates this, first pass metabolism in our liver and can be associated with, with higher levels of 11-hydroxy THC, which might confuse the issue as well with patients. So, I'm in the habit, as much as it's, hard for me to admit as a doctor, to steer people towards the inhalational form initially with, particularly with significant GI conditions, where I say, the last thing you need is something else, which might make you nauseated or give you more cramping, abdominal pain, or diarrhea, things that, some GI can, unfortunately some people experience with oral consumption of cannabis and cannabis oils.
Yeah. Yeah, I could see it can go both ways, because I have met people with Crohn's disease that like the edible route, and that seems to help them the most, but could also have the, go the other way. And do you think sublingual absorption or consumption is a way around that if they don't want to inhale for some other health reason or whatever it might be? Or is there still potentially, because that should skip the GI tract, right? Assuming most of it gets through that way and it's not swallowed.
Right. And I think there's the big dilemma or conundrum or difficulty with sublinguals. You see people put some droppers under their tongue, and you don't know how soluble it is. You don't know how much is going to be absorbed, and after that they're just swallowing it, and it's no different than if they had it in a gummy or a brownie and or a cookie, and so. And I've found in New York State, we've had just recently we gained access to flower for medicinal patients, but prior to that, we were dealing with oils in the form of vaporization pens, tinctures, and straight edibles are in the form of a pill. And the tinctures I found to be least effective for patients and least preferable. For patients as well. And I think that, if you think about how sublingual works, you put some of it on your tongue, some of it's going to get absorbed, the rest is going to get swallowed. So now you've got a partial immediate effect and a partial delayed effect. And so, the dosing, it becomes extremely, difficult to actually predict.
Yeah.
And especially for new consumers, my patients who are new, they're having, I mean, if somebody comes in and they've got active inflammation,
Mm-hmm.
as much as it sounds great to say you apply that locally, I've had plenty of patients too who say that the edibles still work for them who have these GI conditions as well. But the reason I steer them in the inhalational form initially is so I can get a gauge of how they respond to cannabis.
Yeah.
And if they have a negative side effect, well, and especially if it's from a GI conditions, a lot of them get spooked and run away.
Yeah.
So,
Yeah.
I try to introduce it, slowly through a inhalational form.
For inhalation, someone with a GI tract issue, is the use case there mostly around pain for them, or is there another result or benefit from cannabis outside of helping with the pain or discomfort?
Well, yeah, I'm actually very happy that you brought that up, because that goes a lot to the how I stumbled upon this whole wellness interest in cannabis, because inflammatory bowel disease was one of those conditions early on where New York State did allow me to certify patients for medical cannabis. And if you look at the studies of why people are using medical cannabis, you look at, say, well, were they having less hospitalizations? Were they having less, visits to the emergency room? Were they having less diarrhea? Were they having less abdominal pain? The one thing that continues to stand out amongst all of these studies is the quality of life, index. And so when patients would come in, I would, ask them. I always ask all my patients is, what are you trying to accomplish? What is your purpose of using cannabis? And most people can't really give you an exact answer. And even after they've been using it and they come back, and I try to be as scientific and and medical about it as I can, and say, how have you had less bowel movements? Yeah, I think so. Have you had less pain? Yeah. But boy, my quality of life is so much better, right? And so, and then over time, I've realized that there's just more and more people who I've had to kind of fit them into that diagnosis, rather than coming to cannabis for that exact, when people think of inflammatory bowel disease, they don't necessarily think of the quality of life. They think about abdominal pain, diarrhea, and we do have some studies which show that some of that stuff is improved. But over and over again, we have data that shows that the quality of life is improved. And you say, well, what? Then we start thinking about, well, what is this quality of life? What are you referring to? Well, I just noticed throughout the day, I tend to be less anxious, and for some reason, I'm sure that I have less, abdominal pain and diarrhea because of that. And then, or I have individuals who will say, just a couple times a week, it helps me go to sleep. And I'm like, well, you have Crohn's disease. Are you here for insomnia, or are you here for your inflammatory bowel disease? They say, well, I really kind of use it once in a while because it just helps me sleep. And I said, well, you have Crohn's disease, so you qualify. But then the other person who comes in the door who says it would help me 3 times a week to help me go to sleep, they didn't qualify, and it's really crazy. So, I really started to think about this very carefully and closely, and realize that I think the majority of people use it for things that I would not be considered a true medical condition, but also not a recreational purpose either. Right. People historically, what happens, they feel like they're getting a cold or a fever, and so they start taking echinacea, or at night they start to they feel a little tired, they're not ready to go to bed, so they drink a cup of chamomile tea. Well, if I was a doctor, would I prescribe chamomile tea or echinacea as a medicine for that person? Would I prescribe it as a recreational? I don't think so. I prescribe it as supporting wellness and things that help prevent our body from getting sick, and things that help to improve, our current functions, in our body.
Yeah. Yeah, that's a really good point. There's so much overlap there to say, well, pain, sleep, quality of, they're all combined, and so it's really hard to say specifically the use case, or it's across the board in a lot of different ways. I think that's a good transition point, kind of over to the business side. And there's a couple of topics I want to get in around this, but I think to start, and I'm curious, interested around the resort there in Jamaica.